Hi guys, so this is going to be a follow-up video to my life update that I did last week, and this one's going to be about my endometriosis, polycystic ovarian syndrome, and my anemia. So just before I get started, I am going to put a disclaimer out there that some viewers may find this content upsetting, offensive, not really sure what the correct word would be. But I will be talking about my period and about bleeding and about blood, so some viewers may find that offensive. So I just want to put that out there. I don't want to have to categorize this as an 18 plus video on my channel, because I think people under that age could learn from it about what endometriosis is and how it's affected me and my anemia. But I just want to put the disclaimer that some people may be sensitive to the information I'm going to talk about. So that being said, I'm going to go ahead and get started. So about 7 or 8 weeks ago, I started my period as normal, and normally my periods are very heavy, and I throw a lot of clots for probably the first 7 days, and then I have 3 to 4 days where my cycle slowly just starts slowing down, the bleeding just slowly starts slowing down. But when you complicate that in with polycystic ovarian syndrome, which I am going to be doing very shortly videos on what each of those things are, but when you complicate that in, sometimes my periods are longer, and what has happened is I have started not only throwing clots but passing large amounts of congealed blood. And my periods have also been longer and longer. So I bled for 6.5 weeks. And because of that, and I lost a lot of blood during the time, and because of that, my anemia went out of control, and I was barely able to get out of bed. So in bed like 18, 20 hours a day. And then I was trying to do these back to work. So I was working when I could. But that really affected my health, and that's why I was off of YouTube for a while, because I literally didn't have the energy to sit in this chair and talk to you guys. So as a result, unfortunately, it looks like I'm going to have to go back and get another IUD put in. So the type of IUD that I use is Mirera, I think that's how you pronounce it. It's the one that stops your period completely, and it's good for 5 years. So I was on that previous to my husband and I trying to get pregnant, and it was great. It helped with my endometriosis. What had happened is I had my endometriosis surgery, so they did scope surgery, burned off all the tissue that they could, and they learned that I had deposits on my spine and on my lung at that time. And so then they put me into medical menopause for 6 months using a product called Lupron. It's an injection every 3 weeks. And then from there, I got the IUD. So the Lupron brought the endometriosis pain down, because the hormones weren't being produced to make the flare-ups happen of the tissue. And then from there, I went right on the Mirera to deal with the endometriosis, and also because we weren't ready to get pregnant, it just made sense that it would also be a form of birth control. And then, and then had that for 2.5 years, and then 5 years ago, almost 6 years ago, when we got married, I got to take a note in trying to get pregnant, and I haven't got pregnant. And that there'll be another video about that. I'm going to be doing one about our infertility issue. But it's always been, well, hopefully, I'll get pregnant. I have to do it naturally. I'm not able to use a lot of the stuff at the fertility clinic because of my mental health. So it was always, well, we're not going to do anything to prevent getting pregnant, but there's not really a lot of intervention we can do to increase the chance of getting pregnant. And it's just really sad that now it looks like for my health, I'm going to have to get an IUD, which is going to put an end to being able to get pregnant, which is sad. But at the same time, if that's what's going to make me healthy and allow me to do my Cushing's treatment and lose weight and get to the healthiest person I can be, then we'd be in a position along that journey to adopt, to become foster parents again, do something like that, in which I still get to help children and I still get to have children in my life. But I just kind of have to accept that I won't be having any natural children, which is sad. but is the reality. So that's kind of the update on my health and why I wasn't around on Facebook, because for those 6 to 8 weeks I was fighting to get up to go to work for my ease back shifts, and when I wasn't at work I was absolutely sleeping the whole entire time because I had no energy due to the due to the increased amount of blood loss. And then the things that you try to do to get your iron kind to come back up is food. So eating leafy greens with citrus, stuff like that. Well, the problem is I started doing that and my colitis started acting up. So I wasn't even eating food I was eating healthy food still, but I wasn't able to eat the things that are higher in iron. And the number one thing, one of the number one things they look at to eat for anemia is liver, because it's so high in iron, and I cannot eat cow's liver because I'm allergic to it. And chicken liver doesn't have as high, and chicken liver is very hard to find where I live. So it's more the leafy greens, and if you have the citrus with it, the vitamin C with it, it helps your absorption of the iron out of leafy green vegetables. But yeah, those started to upset my stomach. So I was on like toast and tea and juice and like grapes, just basic like watermelon, cucumber, zucchini, like just basic foods, and that wasn't helping. That was taking the hunger away. It was giving me a little bit of energy, but I wasn't really able to get anything that would give me any level of energy. So that's why I wasn't around. And hopefully I will be getting my IUD sometime in the month of May. So I probably am going to have to go through this cycle one more time. Anytime now I could start bleeding again, although it's on no set schedule, because it's only been a couple weeks since I have stopped. But I may have to go through it again, so I may not get my IUD until June, because the clinic that's doing it, they only have certain days where they it's called the Women's Health Option Clinic, because my doctor won't do it and I can't get back into my gynecologist because I haven't been there in a year. So I'm just going to go through Women's Health Options, where they just give you the prescription for the softener that needs to be put on their cervix the 3 days before, then give you the prescription for the antibiotics after, and then give you the prescription for the IUD. They just call it in for you, you pick it up, you do what you have to do, and then you do what you have to do, and then you just take the IUD in and they put it in. But because of this clinic is, it's women's option, so you can get medical abortions there, you can get after 7-week abortions there, you can get IUD insertions, there's the morning after pill, other forms of birth control because there's a birth control clinic where I live, but that's only for people that have a fixed income or low income. So if you're above that threshold but you're trying to access birth control and you don't have a doctor, this is where you go. So there's a lot of stuff that happens there. So there's nurses always there, but there's not always doctors. And so it's a doctor that does the insertion just for safety, because you can tear, and I have tears when you insert IUD, so it has to be inserted by a doctor. So there's only certain days, so I'm waiting to hear back. I'll probably know on Monday, tomorrow, what days are available for May, and then I have to try to work it around my schedule and try to work it around me not starting to bleed again. Once I get it put in, I will probably have 1 to 2 light bleeds. That's what typically happens. It didn't happen to me last time because my period had stopped during the Lupron. But that's typically what happens, and in my case it may even be more spotting and bleeding and congealed blood and clots and stuff because of the situation that I'm in. But once I get it in, it should slowly start to slow down, if not stop right away. So that's that, and that's kind of why I wasn't around, but hopefully I'll have that fixed up here in the next month or so, and then I will be feeling better. So I will do another update once I have my IUD and once I have everything all straightened out, and let you know how my health is improving once I get the procedure done. So that's that. I hope you guys learned a little bit from this. Like I said, I am going to do a video just on endometriosis, just on polycystic ovarian syndrome, just on my anemia, one just on our infertility and how we have dealt with it, the treatment. Yeah, I think there was one other one I said I was going to do. I'll listen to this back to make sure I have them all. But I'm going to do them all separate as health videos. But yeah, for now, that's the update on that. And you can look ahead to seeing the full videos on the different disorders. So I hope you guys have a great day, and I'll talk to you soon. Bye-bye.